in general, I think self-care measures aid is very good. It's a very good alternative to work with patients and their loved ones to help them to measure their side effects after chemotherapy. Well, what can patients do? For example, in the due to their nutrition, they can maybe also together with a nutrition specialist, they can, well, let's say, measure their nutrition behavior. So are they eating well? Are they eating enough? Is their intake enough? And is also, are they drinking enough? Because sometimes patients, well, in our daily practice, after chemotherapy, patients don't drink enough. So that could be one opportunity. And often we see that cancer patients are smoking. And to avoid smoking, that could be another opportunity to support patients and maybe also their relatives to avoid smoking, to help them there with several alternatives. We also, for example, in our hospital in Zurich at the University Hospital, we offer them special programs to help them to stop smoking. Another very important item, especially in hematology patients, especially in patients, for example, with acute myeloid leukemia, is that patients should stay active. So we encourage them also during, but also after chemotherapy, that they exercise, that they are doing exercises, so that they are keeping themselves physically active, maybe together with a physiotherapist, but maybe when they are at home also together in collaboration with a fitness center or another workout center. So we always recommend patients after chemotherapy or during chemotherapy to move themselves about 20 minutes, 2 times a day for 20 minutes. And when it's only a walk, it's also okay. And then to exercise your muscles, because when patients are staying at home, are lying in bed, you are lose very, very quick your muscle strength. So that could be also another way to help patients, to help them to measure their side effects, to do some prophylaxis. Another measurement where we help patients also in the clinical setting is to support them to check their skin. So when there's something special, and well, especially patients after chemotherapy and especially patients after, for example, stem cell transplantation, it's very useful to support them how to check their skin. And that's the most important thing when they should call a doctor or another healthcare professional. Another measurement, so let's say it's a kind of an instrument where we can support patients, is during or after chemotherapy to do a kind of a mouth status. So kind of, let's say, mouth assessments to check their mouth. And when they see something, especially in their mouth, then again to call a doctor or another healthcare professional. Well, one of the last things I would like to mention in terms of self-care measures is, and I think that is sometimes critical, to support patients about medication management. So an example of our daily practice is when patients are leaving the hospital, but also in some complex medication situations in an ambulatory setting, we educate patients, and sometimes also together with their relatives, how they should take their medication, when they should take their medication, what to do when they can't take their medication, and what to do well when all those items doesn't work. So to call earlier in time a doctor or another healthcare professional. So we call it the kind of a micro education tool for our patients, and that's extremely useful also to avoid that patients are not adherent to medication therapies. Well, the other, I think, important item is in this regarding to this topic is that it should be in partnership with healthcare professionals. And sometimes, as I already mentioned, in partnership with nutrition specialists, in partnership with physiotherapists, in partner with nurses specialists, in partnerships with their doctors. And in general, it's my opinion that self-care measure management, so to support patients, shouldn't be something to save time. And in general, I mean with that, to save healthcare costs. Because when it is one of the reasons to save those costs, I think by the end, the outcome wouldn't be good, because it could be also, let's say, an item that patients are using all those self-care measures, and they won't be transferred to a doctor or another healthcare professionals, or maybe they won't contact even healthcare professionals. And then the outcome, the final outcome of side effects after or during chemotherapy wouldn't be so good. Well, and let's don't forget some items I didn't mention yet. I think often patients with cancer are sleeping not so well. So think also about items to support them with sleep hygienic. A lot of patients and relatives do really need support around, so let's say, social support, financial support, and also don't forget that there are sometimes very, very good alternatives in terms of complementary therapies, like a massage, like Jacobson relaxation therapy, etc. So this could, when we all collaborate together and where the patient is in the middle of everything, I think self-care measure aid of side effects of chemotherapy could be a very good item to support patients and their relatives.